All right, for more now on the latest in the COVID vaccine race, I'm joined by Amish Adalja. He's a senior scholar at Johns Hopkins Center for Health Security. It's good to have you on the program. The Pfizer-BioNTech vaccine, it has taken just 10 months to develop, which is a remarkably short time. How can we be sure that it's safe?
We can be sure that it is safe because we've seen animal data, we've seen phase 1 and phase 2, and now phase 3 data. You have to remember that the speed with which this vaccine was made had to do with the fact that it was using a new technology, an mRNA vaccine platform. And that's where we cut the speed down. It wasn't that the safety was that there were corners cut in phase 1 or 2 trials. We will have to follow people once they're vaccinated for years, like we do with all vaccines. But in the middle of a pandemic, we're going to get an emergency use authorization based on the safety data that we have so far. And it does look good. I do think we have to continue to follow, as I said, to make sure nothing longer term occurs, but I do think everything is pointing the right way when it comes to this vaccine.
Amish, are you concerned that there are no long-term observations with this vaccine?
I'm not concerned in the sense that anytime we have a vaccine, it gets approved, and then we follow people out in what are called phase 4 trials. So when the HPV vaccine was approved, we didn't have 2 or 3 or 4 years of safety data, but we followed people even after it was approved, and it ended up being safe. I don't have a major concern. Most of the vaccines that make it this far don't usually have long-term consequences. I think it's important to study that, but to me, I don't think there's going to be a signal here. And I think that in the middle of a pandemic, you also have to weigh the risk and the benefit. And I do think that the vaccines, the way we're seeing them now, are really, it's the benefit that's outweighing any risk that we have with not having the long-term data.
Do you plan to get the vaccine, Amish?
I do plan to get the vaccine as soon as I'm in an eligible group. I am a healthcare worker and take care of COVID patients, so I may be in the first priority group. So I will gladly get this vaccine.
We know Pfizer and BioNTech say that their vaccine is 95% effective. And I know that they were ecstatic about that number, 95%. Why is that number so impressive?
The number is so impressive because we never thought that a first-generation vaccine using a new technology would reach those types of, that level of protection from symptomatic COVID. We were looking at 50, 60%. That's what we would have been happy with. But to see them really hit it out of the ballpark, 90% really made people take a step back and understand that this technology does have a lot of promise, not just for COVID, but for future infectious disease vaccines as well.
We know that vaccine denial is likely to be an issue on both sides of the Atlantic. There will definitely be some safety concerns among the public. How many people will need to be vaccinated to ensure herd immunity and to stop this pandemic?
It's likely going to be maybe 70, 80% of the population. If you assume that everybody has the same risk of transmitting the infection, it may be also the fact that we're not first looking at herd immunity here. We're looking to try and decrease the virulence of this infection to be able to stop people from needing to be hospitalized. So we may be able to give our hospitals breathing room before we get near that herd immunity threshold. So it's important to remember that this vaccine, because it is so effective, is likely to really be able to take the pressure off of hospitals and take the pressure off ICU beds and ventilators. And that's really what's driving a lot of the public health concern about this virus. That's what flattening the curve is about keeping it below hospital capacity.
How do you think governments and public health officials should deal with this vaccine skepticism that we see?
We have to really be as transparent as possible about the process that led to the development of these vaccines, what the clinical trials show in terms of both the safety and the efficacy, try to be able to answer any question that may come up, tell people what we know, what we don't know, and really detail them on all of the benefits that this vaccine may provide and help them make this risk-benefit calculation. We have to be proactive. We cannot be reactive because the anti-vaccine groups will already be going after this vaccine prior to its arrival.
You know, and from expecting too little to expecting too much from these vaccines, I want you to take a listen to what Mark Ryan said today. He's with the World Health Organization. Take a listen.
Some people think that vaccine will be, in a sense, the solution, the unicorn we've all been chasing. It's not. Adding vaccines is going to give us a huge chance. But if we add vaccines and forget the other things, COVID does not go to zero.
Amish, are you concerned that once the first vaccine injection is given, are you concerned that we'll see people drop social distancing, stop wearing face masks, and let down their guard?
We're already seeing people let down their guard, and I do think that there is that danger. You have to remember that the vaccine isn't going to be a magic bullet unless it's coupled with a lot of other things until we get across a herd immunity threshold. And it's going to take a process of years to get the world vaccinated. So COVID-19 is not going to go miraculously to zero. We will still need to think about what measures we need to do to keep ourselves safe, especially for those who aren't able to get the vaccine or who the vaccine doesn't work for. And remember, not everybody's going to be in a priority group. So this is going to be important, that we have to get through this process by using a lot of the common sense things we've been doing from the beginning: wearing a mask, social distancing, washing your hands a lot. All of that's going to continue for some time, even when the vaccine is available.
Let me ask you, before we run out of time, the German health minister says that COVID vaccines will not be compulsory. Do you think that's a sensible policy?
It's going to be hard to make a vaccine compulsory when it's only available on an emergency use basis. I think once you see full licensure and a much more robust safety profile, then I think you'll see schools, for example, or employers making these vaccines a requirement as a condition of entry. But I think in the early rollout of this vaccine, it's likely going to be just something that's highly encouraged, but not something that we will really have a basis for mandating because of the lack of all of the long-term safety data, which we won't have for a couple of years, which then will lead to the full licensure of the vaccine.
Amesh Adalja at Johns Hopkins Center for Health Security. Amesh, it's good to have you on the show. We appreciate your time and your valuable insights tonight. Thank you.
Thank you.